I'm Lorna Renner. I'm the Senior Consultant in charge of the Paediatric Oncology Unit at the Department of Child Health, Kolebu Teaching Hospital. And I'm also the project lead for the World Childhood Cancer Project in Ghana. Well, there have been quite a number of successes, and I'm proud to say that. We're working with World Child Cancer. One has been the establishment of shared care facilities in about 6 hospitals all across the country. And this came about because of the training programs that World Child Cancer facilitated through the twinning program, which they established with the Edinburgh Royal Hospital for Sick Children. And then also, there's also been a reduction in abandonment because World Child Cancer supported treatment and the diagnosis of children who came in, whether they had funds or not. And then also, World Child Cancer has also started a nurse fellowship program, which is an innovation, and I think it's one of the few in Sub-Saharan Africa. And hopefully we'll be able to have well-trained pediatric oncology nurses, and that will go a long way to improving the quality of care for children with cancer, not only in this hospital, but in other hospitals in the country. And World Child Cancer has also supported training for fellows in pediatric oncology, that's doctors. And it's really been, I should say, one of a kind, because some doctors from other West African countries have also joined the program, from countries where there were no pediatric oncology facilities at all. Hopefully they'll be able to go back and establish services for children with cancer. Also, World Child Cancer has been instrumental in raising awareness. That's also a key achievement, raising awareness nationally for both health workers and the public to cancer, to the early warning signs of childhood cancer. And they continue to undertake training programs in collaboration with the Ghana Health Service and the Ministry of Health. Yes, okay. COVID-19, as we all know from last year, 2020, has dealt quite a blow with regards to managing children with cancer all over the world. Fortunately, World Child Cancer has been so supportive here by providing us with personal protective equipment, immune booster, drugs, and even the personal protective equipment was also available for parents and children. They also supported accommodation of parents and feeding of children, and also their transportation from home. So fortunately for us, the impact on the service wasn't that much. We were able to continue our service throughout. And surprisingly, last year, we were able to diagnose and treat over 250 children with cancer, whereas normally would be able to treat just about 170, 180. So despite the COVID, we had many more children coming in with cancers, and we were able to take on the treatment because of the support that we received from World Child Cancer. Specialist training is very important to improve outcomes for children with cancer. You know, cancer treatment is multidisciplinary. Not only doctors, nurses, and doctors of various categories, pediatric surgeons, the pathologists, the hematologists, then we need the psychologists, the nutritionists, and all other cadres of health workers. And World Child Cancer has played a good, important role in ensuring further training of such cadres. This reminds me, one of the achievements was also enabling our pediatric surgeons to improve their laparoscopic surgical techniques so that they'll be able to treat children surgically without too much suffering, because they'll use, instead of opening them up, they'll use instruments just to look in the abdomen and do whatever surgical procedure had to be done without having to open them all up. And then also, pharmacists are very important when it comes to multidisciplinary treatment. And World Child Cancer has started a pediatric pharmacy oncology program as well. So it's important that we work together as a multidisciplinary team, and with the support of World Child Cancer, we've been able to undertake Zoom meetings over the past year, and subsequently we are continuing with that. And we're building on the training and acquisition of further skills through these Zoom meetings. Yes, and so it's very important. If you want to optimize the treatment of children with cancer, you need very good, qualified, trained, multidisciplinary teams. And I think that is one of the key things that World Child Cancer is doing, training multidisciplinary teams. And they're not only training, they're also equipping them. Like pathology, they've been able to equip them with reagents, and also they're assisting hematology to acquire a flow cytometer to improve our diagnostics. Yes, this brings me back to one of the important successes. That's the renovation of the daycare unit. Actually, it wasn't a renovation. It started actually almost like a new construction. It was a very derelict space that wasn't being used for anything. And with funds from World Child Cancer, we were able to build it up and make it like a custom-built daycare unit for children. And that went a long way to transform the care that we could give to the children who were coming on a daily or weekly basis for their chemotherapy. And since 2014, when that unit was opened, we were able to get dedicated nurses for that unit. And that has been supported by World Child Cancer. And last year, World Child Cancer went on further to expand the daycare unit. So I'm pleased to say now, instead of just having an 8-bedded unit, now we have a 16-bedded daycare unit with the capacity to deliver quality care in a safe, friendly environment. Yes. And apart from expanding the unit, World Child Cancer also assisted us to acquire a much larger biosafety cabinet for safe preparation of chemotherapy. So far, we've been in this partnership since 2010, so over 10 years now. And I think it's shown that the partnership, I think, has grown stronger and stronger. So we're hoping that it will even grow stronger still, and that Ghana would become another center for Africa for World Child Cancer, so that we wouldn't just have World Child Cancer in the UK and the US and the Netherlands, but we'd have World Child Cancer in Ghana for Africa. And hopefully, now that we've established shared care centers, I'm looking towards establishing more comprehensive pediatric oncology units. We continue with the training, and hopefully we're aiming that by 2030, our survival from childhood cancer would have gone up in line with the WHO Global Initiative, so that at least 60% of our children will be surviving by the year 2030. And yes, I'd like to say thank you to UBS Optimus Foundation, who've provided funds to World Child Cancer to support the transformation of the Kolebu Teaching Hospital into a center of excellence. They've also supported the establishment of the nursing training program and the pharmacy program, as well as continuing with the fellowship program. And I also like to thank the Department for International Development, the UK, and Celgene, and Love Your Melon, and all the others who have provided support so that the children in Ghana who have cancer have been able to access treatment expeditiously. Thank you.